It's amazing to think about all the things we just kind of take for granted now when it comes to women's health, especially when it comes to getting pregnant. Things that used to be impossible are like everyday occurrences now.
Yeah, absolutely. It really is remarkable how much progress has been made from, simple procedures you can have right in the doctor's office to these incredible breakthroughs in IVF. It's come a long way.
And a lot of those advancements can be traced back to a company that most people have probably never even heard of.
That's true. They've been sort of a quiet giant behind the scenes, a company called CooperSurgical, and they've really grown to become I'd say, the most prominent player in this whole essential area of healthcare.
That's what we're diving into today.
Yes, CooperSurgical and their impact on women's health. It's not just about one specific product or technology. It's really about their whole approach to this field.
Right. From contraception to actually helping people conceive and then caring for women through all stages of life. It's quite a range.
It is. And their mission statement, the way they put it, really captures that scope. Holly Sheffield, who's the current president of CooperSurgical, says their goal is to support healthy women, babies, and families by accelerating what's possible in healthcare delivery.
Accelerating what's possible. I like that. Ambitious, but they seem to be living up to it.
They do, and that's exactly what we've tried to do with this deep dive. We've really dug into their history, looked at all the key innovations they've either pioneered themselves or brought to the forefront through acquiring other companies. And we've also uncovered some of the really compelling personal stories that are woven into all of this.
So we're giving you the inside track.
Exactly. Consider this your shortcut to understanding a company that's had a huge impact on women's healthcare.
Okay, so where do we start with this story? They've been around for a while, haven't they?
They have. It all goes back to, we have to go back to 1958 with a guy named Parker Montgomery.
Okay.
And his big idea, which was Cooper Laboratories. Now, his vision was to build this huge, conglomerate of healthcare companies. Ah, I see.
So he was buying up all these different businesses, but ultimately that strategy didn't really work out as planned. By the early 1980s, Cooper Laboratories had taken on way too much debt, and it put them in a pretty precarious financial situation.
Not a good place to be.
No, not at all. And ultimately, Montgomery was removed from the leadership of the very company he had founded.
So that's where things get interesting, right?
Right, because then, in 1991, a new figure enters the picture, Thomas Bender.
Okay.
He joins the Cooper companies, that's what it was called then.
Right.
And his focus was really on survival at that point, making sure the company could pull through this difficult period. And his approach was to really narrow their focus, to concentrate on medical devices. That was his vision for turning things around.
So getting rid of all the extraneous stuff and really honing in on what they could be good at? Exactly. And he and his team had to make some really tough decisions, selling off parts of the business, streamlining operations. It was a real turnaround effort. Bender himself has said that, they had to communicate clearly to their employees that the priority was the long-term health of the company.
So a lot of hard choices being made.
Yes, absolutely. It was a real turning point. And Bender later became CEO in 1994, really solidifying this new direction for the company.
In CooperSurgical itself, as its own separate unit, when did that officially happen?
That actually happened right in the midst of all this restructuring in 1990.
Okay.
It was officially established as a distinct business unit within the Cooper company.
So they were already on this path of focusing on medical devices.
Yeah.
What were some of those early moves that CooperSurgical made once they were their own entity?
Well, their very first big move was an acquisition. They acquired a company called Frigitronics in 1990.
Okay, and what did they do?
Frigitronics was a maker of cryosurgery devices. So cryosurgery is essentially using extreme cold to destroy abnormal tissue. And in gynaecology, this was particularly useful for treating abnormal cervical tissue, precancerous lesions, by freezing them.
So less invasive, less, scary for the patient than traditional surgery.
Exactly. It could often be done right in a doctor's office, a much more comfortable setting for women. And it meant that many women didn't have to undergo major surgery to have these precancerous cells treated. It was a real benefit for patients.
So it seems like right off the bat, that focus on practical, less invasive solutions was already there.
It was, and it really set the stage for their approach going forward. Finding a clinical need, coming up with a solution that was technologically advanced but also easy for doctors to use, and making sure it could be accessible to patients in a regular office setting.
Right, make it convenient, make it less disruptive. Makes sense.
And then in 1991, they made another really strategic move with the acquisition of Euromed.
Euromed, okay. What did they bring to the table?
Euromed was a direct mail order business that supplied a whole range of instruments and supplies for gynecology practices.
Oh, I see.
So, while Frigitronics gave them this innovative treatment device, Euromed gave them the infrastructure to get more routine, everyday items into the hands of OBGYNs. It really broadened their reach.
So building out that network, becoming more of a one-stop shop for women's health needs.
Exactly. And importantly, they didn't just rely on acquiring other companies. In 1992, they introduced their own internally developed innovation.
Which was?
Electrosurgical instruments for a procedure called AEP, that stands for Loop Electrosurgical Excision Procedure.
Okay.
And this was a relatively new technique at the time, but it allowed doctors to both diagnose and treat precancerous lesions on the cervix using this thin wire loop that carries an electric current to remove the abnormal tissue. And CooperSurgical provided everything that was needed for this procedure: the electrical generator, the specialized wire loops. It was a pretty significant step forward.
Yeah, simultaneous diagnosis and treatment, all one go, often under local anesthetic. Must have been a game changer for women.
It was. It meant fewer procedures, less time off work, less disruption to their lives. And importantly, it helped preserve their fertility.
Huge. So already they're starting to make a real impact.
They are. And all of this was really supported by Thomas Bender's vision for the Cooper companies, this emphasis on these promising areas within healthcare.
Okay, so we're into the mid-90s now. They've got a pretty solid base, but what comes next? How do they keep building on this?
Well, the next phase of their growth from the mid to late 90s really centered on expanding their offerings in women's surgery.
Okay.
And they did this through two main avenues: developing their own new products and acquiring companies that had products that really complemented their existing portfolio.
So filling in those gaps, finding those missing pieces.
Precisely. And a key acquisition during this period was Unimar, Inc. in 1996.
And what did they specialize in?
Unimar was known for its single-use, disposable gynecologic diagnostic products. So things like endometrial samplers, which are used to take tissue samples from the lining of the uterus, and cervical dilators, which are used to gently open up the cervix. These were essential, everyday tools that OBGYNs use all the time.
Okay, so not necessarily the most high-tech stuff, but absolutely vital for good basic care.
Exactly. And providing these as single-use sterile instruments was a big step forward in terms of safety and convenience for doctors and patients.
Right. Minimizing risk, making things simpler.
Absolutely. Then, in 1997, they made a move that really signaled their future direction, and that was the acquisition of Marlowe Surgical Technologies.
Marlowe. Tell me more about that.
Marlowe was the company that brought with it the embryo transfer catheter, which later became known under the Wallace brand. And this marked their first significant entry into the field of fertility care. The Wallace catheter was, and still is, known for its very gentle design, which was all about maximizing the chances of successful embryo implantation during IVF. It was actually the first commercially available embryo transfer catheter originally developed in the UK.
Wow, so they were tapping into that growing field of IVF, expanding from just focusing on the cervix to actually helping create families.
Right. Helping people conceive was becoming part of their mission. And along with these acquisitions, they continued to innovate internally. A good example of that was their introduction of surveillance in 1998.
Surveillance, okay. What was that?
This was a digital imaging system that they developed in-house, and it was designed specifically for documenting and tracking images of the cervix. This was a pretty big deal because at the time, a lot of this was still being done with, older analog methods.
I see, bringing it into the digital age.
Right. So now, doctors could create a visual history of a patient's cervical health over time. It improved diagnosis, made follow-up care easier, and it also made it easier to explain things to patients when they could actually see what was going on.
So better record keeping, better patient education.
Exactly. And the 90s came to a close with yet another acquisition in 99. This time, it was the women's healthcare assets of BEI Medical Systems.
BEI, okay. And what did they focus on?
They had technologies for minimally invasive treatments for various gynecological conditions. Things like endometrial ablation, which is a procedure used to treat heavy uterine bleeding, and operative hysteroscopy systems, which allow doctors to see inside the uterus and perform minor surgeries. This expanded CooperSurgical's offerings into therapeutic procedures for uterine health.
So providing options for women facing these common issues, helping them avoid more invasive surgery if possible.
Exactly. Providing alternatives to hysterectomies was a big focus here.
Okay, so it seems like by the end of the 90s, they had really become a very comprehensive provider of tools for women's surgery. and had dipped their toes into the world of fertility. It must have been a pretty fast-paced decade for them.
It was. They saw phenomenal growth during that time, with their annual sales practically doubling over the course of those 10 years. And they were getting very good at integrating the companies they acquired, really bringing those new teams and technologies into the fold. It was really a period of both expansion and developing that strong internal culture that's been so important to their success. They really were becoming a go-to name in women's health technology.
And you mentioned earlier that the 2000s saw them diversifying even further, pushing into new areas.
Exactly. It's like they were building on that foundation, going deeper into specialized areas of women's health, and even moving beyond just gynaecology into other fields.
Interesting. So what were some of the key moves during those years?
One of the early ones was the 2004 acquisition of Milex Products, Inc.
Miles, okay. Remind me, what did they make?
They were a manufacturer of disposable and consumable products for OBGYNs. Think of things like the Milex pessary, which is used to support the pelvic organs in women who have prolapse, and contraceptive diaphragms.
Oh, okay.
So this acquisition really expanded their range of those everyday consumable products. It was a way of reaching even more women across different stages of life, really emphasizing that commitment to women's wellness throughout their entire lifespan.
So providing contraception, helping manage issues that can affect women as they age. It's quite a scope.
It is. And this was also around the time they crossed that $100 million mark in revenue. So they were seeing significant growth in terms of their business as well.
Makes sense. Okay, so they're expanding their product lines. But then in late 2005, they make a pretty big move into the actual operating room with the acquisitions of Inlet Medical and Neosurg Technologies.
You're right. They were definitely stepping further into the surgical arena.
And what were those companies all about?
These acquisitions were all about investing in minimally invasive surgery, which was becoming increasingly popular at the time. Inlet Medical specialized in laparoscopic surgery devices, things like trocar closure systems, which are used to close up the tiny incisions made during keyhole surgery, and they also had kits for treating pelvic floor disorders.
Okay.
Neosurg Technologies brought with them their innovative trocar system, which had both reusable and disposable components. It was designed to be more cost-effective for hospitals and also better suited for those outpatient procedures that were becoming more and more common.
So they were really building out that whole suite of products for laparoscopic surgery.
Exactly. From the entry point into the body to the closure afterwards, they were covering the entire spectrum of minimally invasive procedures, and they kept moving in this direction with the 2006 acquisition of Lone Star Medical Products.
Lone Star. Okay, what do they make?
They were best known for their Lone Star retractor system, which was this really cleverly designed self-retaining retractor. It became super popular in OBGYN surgeries because it gave surgeons excellent visibility of the surgical field without needing an extra assistant to hold the retractors.
I see. Streamlining things, making the whole procedure more efficient.
Yes, exactly. And what's really interesting is that the Lone Star retractor actually became popular in other surgical specialties too, not just OBGYN. It was just a really well-designed, versatile tool.
So they were expanding their reach into other areas of surgery. It sounds like they were on a roll in the 2000s. And then, to top it off, they moved into prenatal diagnostics with the acquisition of Summit Doppler Systems in 2010.
That's right. They were expanding into new areas and also going deeper into the ones they were already in.
So what was Summit Doppler all about?
They manufactured fetal Doppler monitors. So these are the handheld devices that you use to listen to a baby's heartbeat during prenatal checkups and during labor.
Okay.
So this was a significant move into prenatal care for CooperSurgical, allowing them to provide tools for monitoring fetal well-being.
So from helping people get pregnant to helping care for them during pregnancy, it's a pretty full circle.
It is. And by around 2010, they were offering a really wide range of products. Those core OBGYN office products, contraception, minimally invasive surgical devices, treatments for uterine health, and now these prenatal monitoring tools. They were very much on their way to becoming that comprehensive provider of women's healthcare solutions that they are today. And it really set the stage for their next big move, their full-fledged entry into the fertility field.
And that's what really seems to have put them on the map, right? That focus on fertility in the early 2010s.
Yes, absolutely.
So what was the strategy there? What led them to make such a big commitment to this particular area?
Well, they were seeing that there were incredible advancements happening in assisted reproductive technologies, particularly IVF. It was becoming a much more accessible and successful option for couples facing infertility.
Right? It wasn't this niche experimental thing anymore.
Exactly. It was becoming much more mainstream, and CooperSurgical recognized that this was a growing market, a growing need, and they made the strategic decision to go all in on becoming a leader in this field.
So they saw the opportunity and decided to grab it. And what was the first big step in that direction?
It was a truly watershed moment, the acquisition of Origio AS in 2012, and this was a game changer.
Regio. Okay. Tell me about them.
So, Origio, formerly known as Medicult, was already a leading global player in the IVF space. They were based in Denmark, and they developed and distributed a wide range of highly specialized products that are used in every stage of the IVF process, from the culture media in which the eggs and embryos are grown to the specialized lab dishes and pipettes, and even the larger equipment used in IVF labs.
Wow. So they were already doing everything, basically.
Essentially, yes. And they had a strong global presence with distribution in many countries. This acquisition was transformative for CooperSurgical.
It sounds like it.
It instantly gave them a global footprint in fertility technology, and it was really about providing a complete solution. I mean, think about it. With Origio, they could provide pretty much everything an IVF clinic would need.
So not just one piece of the puzzle, but the whole puzzle.
Exactly. And Origio's expertise in IVF culture media was particularly critical.
Culture media. Explain that a little bit.
Sure. So culture media, it's like this very specific nutrient broth that's used to grow the eggs and embryos outside of the body. And there are different formulations for different stages of development. Origio was a leader in developing these really crucial recipes.
Okay.
So by acquiring Origio, CooperSurgical was putting themselves at the very heart of the IVF process. They had control over these essential formulations.
So a really strategic acquisition.
It was. They also brought with them well-established brands like Sage Media, which is a type of culture media, and Cryotech, which is for cryopreservation or freezing of embryos.
Sounds like it was a perfect fit for what they were trying to do.
It really was. And it led them to officially form their Fertility and Genomic Solutions business unit. It was a clear signal that this was a major focus area for them. One embryologist I was reading about actually commented on this, saying that it was clear that CooperSurgical was really invested in making every single step of the IVF process better for both the lab and the patients.
So they were taking it seriously. It wasn't just a side project.
No, not at all. And they continued to acquire other key players in the fertility space. They were really determined to be the leader in this field.
So what came after Regio?
In 2015, they acquired Research Instruments Ltd, or RI, a UK-based company that specialized in advanced IVF equipment.
Okay, so more equipment for the lab.
Yes, but very specialized equipment. They were known for their micromanipulation devices, which are used for ICSI, which is intracytoplasmic sperm injection. It's a technique where a single sperm is directly injected into an egg.
I see.
And they also had developed the RI Witness system, which is an electronic witnessing system for the IVF lab. It's designed to prevent mix-ups of sperm, eggs, and embryos, which is obviously incredibly important.
Yeah, you don't want any mistakes happening there.
Right, absolutely critical. So this acquisition further solidified CooperSurgical's presence in the IVF lab, giving them even more of the tools and technologies needed for those delicate procedures.
So from the very beginning, handling the sperm and eggs, all the way through to embryo transfer, they were involved in every step.
Yes, and then in 2016, they acquired K-Systems, which was a Danish company.
Okay, what'd they bring?
They were known for their essential IVF lab equipment. Things like benchtop incubators, laminar flow workstations, which create that sterile working environment, and even the specialized furniture for IVF labs.
So they could outfit the entire lab now.
Exactly. They could provide everything. Paul Remmel, who was a key figure at CooperSurgical at the time, actually commented on this, saying that K-Systems was just a perfect fit with Origio's existing offerings. It really completed their portfolio for IVF clinics.
So they had the culture media, the equipment. They could even set up the physical space. It's pretty impressive.
It is. And around the same time, in late 2016, they actually reacquired the Wallace line of IVF catheters and needles from Smiths Medical.
Oh, Wallace, that's the one we were talking about earlier, the embryo transfer catheter.
That's right. It had originally been part of that Marlowe acquisition years earlier, but they brought it back under their own ownership. The Wallace catheter is a classic. It's been used successfully for so long, and it's really the gold standard for gentle and effective embryo transfer.
So they had the whole IVF process covered now, from start to finish. It was really a complete package.
It was. And then they made another incredibly significant move. They entered the field of genetic testing and fertility genomics.
But this is where it gets really cutting edge.
It is. This was in 2015 and 2016, and they made two key acquisitions, Reprogenetics and Recombine.
Okay, I'm going to need you to break those down for me. What did each of those companies do?
Sure. So Reprogenetics was a leading laboratory that specialized in preimplantation genetic screening, which is also known as PGS, and preimplantation genetic diagnosis, or PGD. These are techniques used to test embryos for chromosomal abnormalities and certain genetic disorders before they are implanted in the uterus.
So, trying to ensure that the embryos that are chosen for transfer are the healthiest ones.
Exactly. It's about maximizing the chances of a healthy pregnancy. And Recombine specialized in something called expanded carrier screening. This involves testing the prospective parents to see if they are carriers of any genetic mutations that could potentially be passed on to their children.
So you're getting a really complete genetic picture now, from testing the parents to testing the embryos themselves.
Exactly. And they brought all of these genomic services together under one name, Cooper Genomics. It was a powerful combination. Now they could offer this comprehensive genetic testing that could really help answer that crucial question for couples going through IVF. Which embryo has the highest chance of resulting in a healthy baby?
It must have given people so much more peace of mind knowing that they were doing everything they could to ensure the health of their future child.
Absolutely. And it's not just theoretical, it really has made a difference in people's lives. One of their own employees, Rebecca, actually used carrier screening and pre-implantation genetic testing. She was a carrier of the BRCA1 gene mutation and also cystic fibrosis, and she was able to use these technologies to have a healthy child free of those genetic conditions. It's a great example of the very real-world impact of these technologies.
So they were practicing what they preached, in a way.
Exactly. And by 2016, 2017, they had created this incredibly comprehensive offering in the fertility space. It really was an IVF ecosystem, as some people were calling it.
So they weren't just providing pieces anymore. They were providing the whole picture.
Yes. And it revolutionized the way IVF was being done. They officially launched CooperSurgical Fertility and Genomic Solutions, really emphasizing that they now had solutions for every step of the assisted reproductive technology cycle.
And clinics were loving this, I'm assuming.
They were. I mean, think about it from their perspective. Now they could go to one company for all of these essential products and services. It streamlined their workflow, made things so much easier.
Less hassle, more efficiency.
Exactly. And I remember reading about Dr. Olivia Chen, who's a reproductive endocrinologist, and she was talking about how much CooperSurgical's integrated approach had improved her clinic's efficiency and patient outcomes. Having everything under one roof, so to speak, really made a difference.
So it was a win-win for the clinics and the patients?
Absolutely. And they kept building on this momentum. They acquired the Life Global Group in 2018, which was another major provider of IVF culture, media, and lab supplies.
So they were still growing, still expanding their reach.
They were. And they were really starting to be recognized as the dominant player in the IVF lab. I even remember reading something where someone called them the Apple of the IVF lab.
The Apple of the IVF lab. That's a pretty good analogy, I think.
It is. It really captures that idea of them having created this really sleek, integrated system where everything works together seamlessly. And there are so many stories out there about people who have benefited from this, like Laura, whose IVF journey involved using Cooper Genomics genetic testing and the embryo options platform to manage her frozen embryos. These technologies really made a difference in her journey.
And it sounds like that embryo options platform is another good example of their move into digital health solutions.
It is. They were starting to really embrace that side of things. And by the end of this period, they were firmly established as the global leader in both IVF and reproductive genetics. I mean, they were serving clinics in over 100 countries. It's really remarkable how quickly they rose to prominence in this field.
And I think it's safe to say that at this point, almost every baby born through IVF has probably benefited from a CooperSurgical product or service in some way.
I think that's a very safe bet.
Yeah.
And their mission statement really reflects this. They talk about delivering industry-leading technology to the healthcare providers who are helping patients realize their dreams of family.
It's a pretty powerful mission.
It is. And under leaders like Holly Sheffield, they were also starting to explore really cutting-edge areas like the use of artificial intelligence in embryo selection. They were really on the forefront of innovation in this field.
So they were at the top of their game, and then the 2020s came along. What was the focus for them? in this new decade?
The 2020s have really been about integration, filling in any remaining gaps in care, and looking ahead to the future of women's health with an eye toward digital tools and global reach.
Okay, so building on what they've already achieved, but also looking ahead to what's next.
Exactly. And all of this is happening under the continued leadership of Al White at the Cooper Companies and Holly Sheffield as president of CooperSurgical. They're both very much focused on making sure that CooperSurgical continues to innovate and evolve to meet the changing needs of women's healthcare.
And one of their key focus areas in this new decade has been enhancing care during and after childbirth.
Yes, absolutely. They've recognized that this is a critical area where there's still room for improvement, and they've been making some important moves to address that. A good example of this is their 2021 acquisition of Safe Obstetric Systems.
Okay, and what do they bring to the table?
They were the makers of the fetal pillow, which is a really ingenious device that's used during cesarean sections and those challenging situations where the baby's head is deeply impacted in the mother's pelvis.
Ah, I see.
It's basically an inflatable silicone balloon that's gently inserted to elevate the baby's head, making the delivery safer and easier for both the mother and the child.
It sounds like a really important tool for those difficult deliveries.
It is. Studies have shown that its use can really significantly reduce maternal complications like uterine tears and excessive bleeding. It's a real advancement in making C-sections safer.
So addressing a crucial area of risk in childbirth.
Exactly. And they continue to strengthen their offerings in obstetrics with the acquisition of several products from Cook Medical's reproductive health business in 2022.
Cook Medical, okay. What do they get from them?
They acquired the Bakri postpartum balloon, which is a vital device used to manage postpartum hemorrhage. That's a leading cause of maternal mortality worldwide.
So another tool for addressing those potentially life-threatening complications.
Yes, very important. They also got Cook's cervical circlage devices, which are used to help prevent premature birth in women who have what's called cervical insufficiency.
So they're really covering the spectrum of care for women during pregnancy and childbirth.
They are. And, as Holly Sheffield has said, ensuring the safety of both mother and baby during these critical times is a top priority for them. These acquisitions are all about giving healthcare providers the best possible tools to do just that.
And let's not forget their continued work in contraception, especially with their acquisition of Paragard back in 2017.
Yes, Paragard is a big part of our portfolio now.
They launched an improved version in 2021, right?
They did. And what makes Paragard so unique is that it's the only hormone-free copper IUD available in the United States. And this new version that they launched in 2021 came with a redesigned single-handed inserter, which made it much easier for healthcare providers to place the IUD.
So simpler, less painful for the patient, I'm assuming?
Exactly. It was all about making this already popular non-hormonal option even more accessible to women.
And I know we've talked about it before, but they've also been really proactive in embracing digital health and data management in women's health.
Yes, absolutely. The acquisition of Embryo Options, which we discussed earlier, is a prime example of that. It's a digital platform for managing frozen embryos, and it's really transformed the way that process is handled.
Right, bringing it into the 21st century.
Exactly. They've also developed other patient-facing resources, like the mobile app for their cord blood registry, and Cooper Genomics has expanded its telehealth offerings so you can have virtual consultations with genetic counselors now.
So making it more convenient, more accessible for people.
Yes, and they were really quick to adapt during the COVID-19 pandemic, providing a lot of support to IVF clinics and obstetrics departments to help them navigate those challenging times. They were very proactive in helping healthcare providers stay connected with their patients.
So it sounds like they're not just focused on the products themselves, but also on the whole ecosystem around those products, how they can be used most effectively.
That's a good way to put it. And internally, there's been a real push for collaboration between their different divisions. For example, the Office and Surgical Products Group and the Fertility and Genomic Solutions Group are working together more closely now to see where they can share technologies and expertise.
So breaking down those silos, getting everyone talking to each other.
Exactly. And it's leading to some really interesting innovations, like, for example, their expertise in cryopreservation or freezing from their IVF work is now being applied to their donor egg bank services. And they're even exploring how some of the concepts behind their obstetric devices could be applied to fertility treatments. It's really exciting to see that cross-pollination of ideas happening.
And it seems like global expansion and advocacy are also increasingly important to them.
They are. They're actively participating in working groups with the World Health Organization on issues related to infertility. They're involved in various initiatives aimed at expanding access to long-acting reversible contraception in underserved areas globally. And their cord blood registry is a major collaborator on research trials exploring the potential of cord blood therapy. They're really taking a leadership role on the global stage.
It's great to see a company taking that kind of responsibility seriously.
It is. And it's not just about, top-down decisions. They really value feedback from both patients and healthcare providers. They've established both formal and informal channels for getting that feedback, and it's directly led to improvements in their products.
Can you give me an example of that?
Sure. They actually redesigned their IUD removal hook based on feedback from healthcare providers who were saying that the old design was a little bit tricky to use.
So they listened and they made a change.
Exactly, and they're also using that feedback to develop entirely new solutions. For example, they're working on a unified software platform for managing all aspects of an IVF laboratory. And that's really being driven by the needs and input of the people who are actually working in those labs every day.
So a very collaborative approach to innovation.
Very much so. And by the mid-2020s, their reach is just phenomenal. They really touch almost every stage of a woman's life, from routine gynecological care to contraception, fertility treatments, prenatal care, childbirth, and even managing issues that arise later in life. They're a real force in women's health.
And it all goes back to that early decision to focus on medical devices and specifically on women's health.
It does. It was a smart move, and they've executed it brilliantly. One medical journalist I was reading recently called them a unique force in the industry because they've been able to bring together so many different solutions, from basic contraception all the way to the most cutting-edge reproductive technologies. It's a really impressive portfolio.
It is. And it's clear that their company culture plays a huge role in all of this. So what can you tell me about the culture?